There are several variants for several different reasons, and this one is called the Acute Low Back Pain Protocol. If someone just got hurt this morning, last night, this still may not be the best thing for them because all of the inflammation hasn't hit yet. And that inflammation is important because a lot of healing compounds, chemicals, properties are part of the inflammatory process. So to make this like the best possible, you would want to see someone 3 to 5 days after the incident. And in the meantime, like I woke up, my back went out, you can help. It's just not as effective as if they came to you 3 to 5 days later, because that allowed all of the processes that come with inflammation, which by the way is the first healing process in the body for any injury. If that, we're going to assume this is like 1 week in. The reality for this model is she had a car accident 1 year ago, but we're going to treat her as though this was 1 week in.
And in the meantime, what can they do?
In the meantime, she's set up in a resting position, so that is a passive position of decompression. So we're decompressing ankles, knees, hips, low back, shoulders, and neck with this position. I placed her in this position a few minutes ago, and she is pain-free. When she walked in, what was your level of pain?
5.
She was at 5, and she's kind of been running at a level 5 for a long time. But just this position gives relief. She is good because she sleeps in this position or close to it, so she is getting that decompressive. But this is passive, so that means there's no muscles being strengthened to hold your body where it needs to be. It means there's nothing in the feedback loop, like this is how you're supposed to move, this is how you're supposed to get better. So everybody should do passive, but as they improve a little bit, you're just getting right outside of that first inflammatory response. It needs to go active, and that is movement that doesn't increase pain. And that starts to train her own body, her own system to decompress the spine, because she is compressed, which is causing pain and irritation on the left side. Now, most people with low back pain, it's going to be worse on one side or the other. If it's dead center, you still do the protocol, but you would do both sides equally. Dead center is pretty rare. So we're going to treat her as though this is the side of the injury, her left side, and we always want to treat the less injured side first. Part of that is to create a feedback loop in the brain. We're doing things over here, and the brain is understanding how that feels, and that's the better side. So when we come to this side and it feels different, the brain is like, uh-oh, I like balance, I want to be good, how do I get that to feel like this? And so we're working with her own neurological feedback loop to get things better faster. So first things first, we set the client up in anatomical neutral. If there is discomfort after a minute in this position, you might need to put this rolled towel underneath L5-S1. How do you find L5-S1? It's directly behind the ASIS, so the most prominent parts of the front of the pelvis. And then also for the person on the table, it would be in line with the dimples going across the low back, L5-S1. So the more you do it, the more you get used to it. And for people who cannot lift their hips so that you can slide this under, you would put this on the table and then have them get back on the table. So you would leave enough room for the backside to be in front of it, low back on there. And this will help them at home too when they're doing their own self-care. So legs externally rotated, which means the knees are a little further apart than the ankles. If the ankles were further apart than the knees, that's abduction. That's not what we want. We want her toe pointing straight up and then gravity rolling it out. So it's not frog legs really spread out. It's just this is straight and that is gravity. So slight external rotation unloads the pelvis, which unloads the low back, And then, as the therapist, we're going to come down and gently traction the pillow. And so you can see some movement there. I'm creating just a little bit more traction. Now we're going to roll the shoulder back and down. So the palm has her shoulder blade in it, and I'm going to put the ball of her shoulder in the center of my palm, and I'm going to pull my hand down and just follow that rotation. Her hand's right there. Rotate out, come down, and place it right back on the body. That shoulder blade, and I just placed her shoulder blade in my hand, and the center of my palm goes on the ball of her shoulder, and I'm pulling down with the palm of my hand, just sliding, and I'm following. I'm not pushing really hard, I'm just following this down. Her hand ends up right here, and then I'm going to continue with a little traction and down. We're increasing the space between her shoulder and ear, and we simply place her hand back there. Now we're going to do compression and traction of the neck. My hands are placed under her neck just like this, and we're going to see which one feels better. So we're going to start with gentle traction. Big breath in as you exhale. Pay attention to how that feels. Any discomfort? No. Okay, that's traction. This was gentle compression. Any discomfort there?
No.
Which one feels better?
That one.
So she chose compression, so we're going to hold compression. And you can see I'm not pushing really hard. I'm just gently, as soon as I see some movement, I'm gently compress. And then go ahead and take 3 to 5 big breaths in and out. And so your next couple breaths, don't breathe in so big that there's pressure in your neck. That's perfect. Just let your neck and body be heavy. And so these verbal cues I'm giving are helping her body to relax. She is doing the work, and then she is relaxing. I'm not saying, relax, relax, relax. Okay, now, as she inhales, I hold the compression. As she exhales, I'm going to go into traction. And naturally in our body, when you inhale, your spine goes into gentle flexion. And when you exhale, it goes into gentle extension. The easy way to remember it, you only remember one. Exhale, extension. Extension is lengthening and creating space. Any discomfort now? So remember, this is the affected side. We're going to start work on the non-affected side. So I'm going to reach under her body. If you want, you can shoot from right here. The easiest way to get under her body is where the top of the hip is. So I'm going to slide my hand up and then down. And I'm looking for the SI joint, and it's going to be on the pads of my fingers. And so if I just gently push the pads of my fingers up, I can move her whole body. And I'm not working hard, I'm just gently lifting the pads against her SI joint. And we're going to place our forearm. This is the ASIS, the front bone of the pelvis. My forearm is gently below that. And when she inhales, I'm going to push up, exhale, I'm going to drop down, unloading my fingers on the back and tractioning that hip. Inhale up, exhale down. So what I'm doing is, she inhales, I push my fingers up. She exhales, I let my fingers down, sink in, and I traction. So I'm literally trying to pull her hip down and away. So go back in there. You don't have to breathe slow, just in and out. And let it go. That's it. And so we've done that a couple times. We're going to come around to TFL, which also attaches to the IT band. And that forearm pressure, not elbow pressure, I'm using my soft forearm here. And I'm going to bring the knee out a little bit, which softens that muscle, tensor fasciae lata. And then I'm going to rotate it in, which stretches it. And I'm going to kind of go with it, release the pressure, bring the knee out. Go with it. You feel that gentle stretch? Mm-hmm. Good. We're going to do that a few times. And what we're doing is taking pressure off the hip so that the spine can relax. And so when you're working on a man, you have to be careful of your angle because you don't want to be across midline. When you're working on a woman, same concern, just less material. So here we go. My angle, my hand's way out of midline, and then we're using motion to do the work. So we lean in to the tissue, and then we release the tissue. Lean into the tissue. I'm using my body weight. I'm not muscling anything. There we go. So we come out from there. From there, we go into myofascial release down the quads. And this is going to be 3 to 5 strokes, depending on time. And so the steeper your angle, so this is not a steep angle, that's no angle. And then the steeper your angle, the less discomfort your client has. So you want to take all of that tissue. So you need some friction. You see how the skin is moving? I'm putting tension on the skin behind, and I'm softening everything in front. That is how myofascial release works. And we're not actually forcing anything to happen. What's happening is her body is perceiving tension behind the muscle and relaxation in front of the muscle. She's processing that information, and the brain will tell the quad to relax. And when that happens, you'll feel the quad undulate or vibrate. That's the unconscious nervous system doing work for us. So you're having two dialogues. Anything that's audible is with their consciousness. Anything that's tactile is with their consciousness and their subconsciousness. So come back, find a different line, go down again, and we should have softness in front of our pressure. And that's where things happen. So I'm going to repeat this sequence on the affected side as soon as I do this third stroke. Can you tell me what's after myofascial traction? Am I tractioning the leg or anything?
No, it just says repeat on opposite side, and then walk it out.
Perfect. Okay. And if you want, you can check to see if that quad softened. You come down. It's good to maintain flow by maintaining contact, and then once we're on this side, we can come to this side. No surprises. They know we traveled around the body, and that's what we want. We want to be kind to their central nervous system. Any discomfort when I push up there?
Not really, no.
Is it more tender than the other side?
It is.
Okay. And if someone doesn't pick up on whether or not something is tender, this spot, the SI joint, is very similar in structure to their elbow. So if it feels different than their elbow, there is tenderness. If you come around, you can see I'm pushing on their elbow. This is what skin on bone should feel like, and this often is more tender, and you can often feel inflammation here on their SI joint. So pads of the fingers pushing up, forearm pushing down and tractioning, big breaths in, and let it go. In, out. So as she breathes in, I gently push the pads of my fingers up into that SI joint, and I let go and push down with my forearm as she exhales. Now we're going to go around TFL. I'm going to put pressure in there. I lean into it and stretch. Bring the knee out, pressure, lean into it, stretch, release the pressure. Every time you release the pressure, blood will flow back into the area. You can think of muscles like sponges. You add pressure, blood goes out of the muscle. You remove the pressure, blood comes back in. Why is that important? Because fresh oxygenated blood is what heals the body. So the point of this treatment is to decompress the spine, gently let the body know that it can heal, and then support the body's healing processes with our movement and strokes. And we come right back up into that myofascial down the quad, and we can feel this quad is tighter. You feel this one's tighter. Right, good. So we're going to just cruise. And if you want, you can tell your client big belly breaths. As they exhale, let their body be heavy on the table. Sink into the table. Look for words that are not threatening or commands. So I stay away from telling people to relax, because that can come off as a challenge. So I just say breathe deep and just let it go. As you exhale, let your body be heavy. Give them mental imagery that works with what you're trying to accomplish. And so with my setup, I'm leaning into it instead of muscling through the stroke. Any discomfort?
No.
You feel that quad wiggling under there? That's good. That's good stuff happening. And yes, these strokes are slow, but that's okay. If you had all the time in the world, each one of these strokes could be 3 to 5 minutes. Each stroke, 3 to 5 minutes. I don't know if the camera picked it up, but while I was coming through, this tissue is just fluttering right there. So we're going to do a couple more strokes. I'm on lateral quad, not IT band. IT band is a non-contractile, non-stretching structure. It's a sheet tendon, and the muscles that operate it are what we should be pushing on, not the tendon itself. You can't see it, but the quad is just like undulating under the pressure. So there is more that can be resolved, released, loosened, whatever you want to say. I could do 3 to 5 more strokes. I could slow the strokes down, but for instructional video's sake, we're going to end that there. I'm going to come back, check, quad softened a little bit, and then I'm going to have Joni roll to the side that she thinks will feel better and get up from her side. No sit-ups. So roll completely onto your side, like fetal position, and then get up from your side. And then you're going to walk around and see how that feels. If you have a big bolster, it helps to lift the bolster so they're not sitting on it. So this is the walk it out, and what we're looking for is a change. Do you feel different than when you lay down?
Yes.
For sure. Do you feel taller?
Yes. And looser.
That's will decompression. So in a full hour treatment, we would work both sides, but for demonstration, we're going to go straight to the affected side. In a full hour, you always work the better side first, so that's going to be the good side up. So for her, we're going to work on her affected side, which is the left side. So she is going to sit on her right hip, bring her knee up, try to be as tall as she can, and lay down on her side. And I'm going to help her go down and bring the bolster up under her head. So sit down on that right hip, bring your knee up, and then lay down on your side. You just bring that bolster right up. There it is. So this is the setup. And for this setup, would it be better if I worked her on the other side of the table so the back is facing? Okay. We're going to rewire this.
And you can explain that. We'll edit this out, but you can explain we just moved her so that you could get a better view.
Are there any key points in the setup, Trish?
Bring them to the table, have their good side down, touching the table. Remind them not to brace against the table, let their body sink into the table. Loose fetal position, sorry, I'm just reading key points.
That's perfect.
Um,
So I'm going to go over that part and then we'll move on.
Sorry, and then it does state that like if we are working with a larger person, you will have to change this positioning to be able to accomplish the same thing.
All right. So I had her come to the other side of the table so it's easy to see in the camera. And we always want to remind the client that whatever's touching the table should be relaxed. Let their body be heavy. Whatever we're going to do, they will not fall off the table, so they don't have to brace against the table. Now I'm going to reach under, and I'm going to lengthen the good side. There we go. So this is long. We're not going to compress it with anything we do up here. Legs are good. So we're going to start with positional release. Is that on there? Okay. So I'm going to simply one hand on the hip. Where do you grab on the hip? The center of your palm goes to where the bone on the side of the hip is. It fits nicely in your palm, and then rib cage, and we're simply going to gently push them together. And if we see skin fold, we are compressing. Why is this important? Any discomfort there? No. So when we compress this musculature, it has nothing to pull on, which means it starts to soften because the brain realizes that you're doing the job it's been trying to do, that spasm, that pull, so it no longer has to do that. 3 deep breaths as big as you can and just let it all go. And this is a static hold. We're not trying to push and pull as she breathes. Just simply rib cage and hips. And sometimes you'll hear or you'll feel through them, a bone will click in this position just because the muscles relax enough to allow one of these vertebrae to go clunk back in place. Now from there, we're going to traction. So tricep on the hip, hand here, and we're just going counter pressure. So this is coming down with my lat, and my hand is going up, and we're lengthening her spine and decompressing her hip. Any discomfort there? Good. Big breath in and just let it all go. So you could do a couple of strokes there. Big breath and let it all go. And this is gentle. It's just enough pressure to create some traction with your glide. We're reminding her brain that it's okay to be as tall as her driver's license says she is. No shrinking here. And then we'll hit it one more time, going up. And then we go into what I call audience participation or teamwork. And this is really important because as a therapist, you'll be tempted to do all the work. Her brain needs responsibility in the healing. So we are going to have her do the majority of the work. Now, you don't do this if that causes pain. So we're going to check and see. So leg comes out. Any discomfort there? No. So you're going to inhale and lift so that your leg is right there. Exhale and lower like you're trying to touch the floor with the arch of your foot. Inhale up. Exhale down. and then we're gonna just come right down. I'm using the web of my hand to come all the way down, right over the hip. Inhale up, exhale down. If you can keep that in line with your body, I'm gonna come up here and increase my leverage. So I work even less far. Inhale up, exhale down. How's this pressure? Inhale up. Big person, use both hands, go all the way. So you have all this real estate, you get oblique, you get everything. Inhale up, exhale down. The harder they exhale, the better this works. Why? The QL is a respiratory muscle. Anyone who's thrown their back out with a sneeze, a cough, a hiccup, that's because QL was involved. And then let that go, take a little break, make nice. This is much more powerful than it looks because you're applying pressure through a specific stretch, which involves all the fibers in the muscle because you're putting pressure through eccentric loading. Anything eccentric, more muscle fibers than concentric are recruited. So from here, we're going to go into the deep 6 rotators. And that includes piriformis. We don't have x-ray vision, it doesn't matter. From the hip bone, you create a fan shape or a pie shape, and you want to hit different spots along that fan shape, and you can go all the way down to just before the SI joint. And to do that, we're going to externally rotate, because these are hip external rotators, so now I'm shortening them, and I'm going to take that tissue, pull down, and then we're going to gently stretch. Some people have really tender hip rotators, so the first pass should be quite light. How's that pressure?
Good.
And you feel the muscle stretching? Good. And you'll be able to feel that tissue sliding under your pressure, and with each stroke, you release the pressure. You don't have to release contact, you just release the pressure to allow that blood to come back in. Release, release. So shorten the muscle, pin the muscle, stretch the muscle with the pin, release. So pin, stretch, release. Pin, stretch, release. I'm always hitting a different spot. And they will tell you, ooh, that's a good spot. You don't have to stay there. Come back to it. She just did it. So I'm going to come back to that. I just made a mental note. I'll just come back to it. And I'm actually going to come back to it, but hit a different piece of it, because they're like bands going through the deep part of her hip. These muscles lay underneath the glute muscles, so they're pretty deep. But in this position, her glute is relaxed. You can actually see that just a little bit. And then again, nice nerve stroke. So from here, we're going to go TFL, gluteus minimus, which is actually deep to medius, and gluteus medius. That's like a triangle there. Now for people who are interested and they're like, oh, I used to have a strong butt, but now my butt is hanging down, it's gluteus medius that needs help. And so it's really easy to work gluteus medius, and it will lift the whole backside, but better than that, it'll keep you mobile longer. So it is a very important locomotion muscle. So I put a little bit of lotion to decrease the skin drag. I'm going to have her stay in this position and just roll her hip so her toes point up. Nobody's toes are going to point straight up unless they have really incredible mobility. And we're going to go right through TFL, nice and gentle. You can go on top of the clothes, or if you have permission, you can go under on that muscle. Is that pressure okay?
Mm-hmm.
Is that a little tender?
It is a little spicy.
Okay.
Just spicy.
So we'll go on top. And so there's just less glide when you go on top. It's a shorten, pin, stretch, and release. And again, it's a different spot each time. You can use forearms, you can use hands, you can use thumbs, you use whatever works for you. If the person is big, you're going to want them to do all the lifting. So inhale up, exhale down. I'm just guiding with this hand. Inhale up, exhale down, okay? Now you're gonna let your foot be neutral or pointing to the wall, and we're gonna go for gluteus minimus. Inhale up, exhale down.
Paul, do you want to mention how far down to go with TFL and then the glute min and knee?
Yep, good. How far down do we go? We stop at the head of the great trochanter. And how far their leg moves down is up to their mobility. So I'm just using the heel of my hand in here. And then sometimes you can remind them to let their body be heavy on the table. So now we're going to go gluteus medius. So they're going to, without rolling their body, roll their leg, toes to the floor, and we're going to pin it, exhale down. And this, the leg comes forward just a little bit. So instead of being in perfect line with her body, it's forward, toes pointing to the floor. Good, that's spicy, huh? Good. So I'm using a soft fist. I can easily use the palm of my hand. I can use a thumb. I can use an elbow. I could use a forearm. You make it work for you. So I'm going to have you lift and go down just 3 more times, and watch, I'm going to change the angle so it's even easier on me. Anytime you're working on big people, you do not want to put yourself at risk working on someone bigger than you. So having options fixes everything. So now I have my knee bent to protect my knee, her feet against my thigh, so that I can have control and have her feel supported. And then we do a nice little nerve stroke for that group. This goes faster when you're doing it in practice than when I'm showing it. The next move is a big move, knees healthy and good. So you can guide with the ankle. So I'm going to have you inhale, bring your leg back as far as you can. Ideally, you want that glute to turn on. Exhale, bring it forward. Tap the table, and then lift your knee. Is that okay? Okay, so here we go. Inhale, and I'm going to pin the glute max, and lift your knee. Perfect. Inhale back. I'm going to pin a new spot. Lift your knee. That's the end of the stretch. Release. Pin a new spot. Forward, lift, and release. Pin a new spot. Good. Lift and release. And pin. One more. And pin. Take a break. Good. Now, if you ask for permission and your client says it's okay, you can grab the waistband and you can run your knuckles through with that motion. The reason you need to ask is because you will inadvertently expose the gluteal cleft. You could have draping help. Skin on skin, running the knuckles through often is more effective, but you're going to get, I don't know, 90% benefit going through the tights, going through the shorts. You don't have to do skin on skin.
Do you want to talk about where their endpoint is if they are doing skin on skin, like what to aim for with that?
Yeah, you want to end just, you can come around so you can see. You want to end just at the ischial tuberosity. So my thumb is on her ischial tuberosity. Hamstrings originate there, glutes come in. So as we do the movement, and you just come right off of that. It's the same if you're going through the clothes, it's just you're not gliding. You're pinning, pinning, pinning. Pinning, pinning, pinning with that movement.
I wonder, did you also talk about why we're getting them through all those ranges?
No, that's a good point. While the reason we do this big range here, so inhale, leg comes back. The glute is short and contracted in this position. As she comes forward, the glute is relaxing because her hip flexor is flexing her hip. Taps the table. The glute is almost at its full stretch, and then she goes into external rotation with flexion, which is the full stretch on the glute. So we're taking the glute as close to its full range of motion as we can with pressure under stretch, which makes the most fibers get addressed in that stroke. Now we're going to do the exact, excuse me, we're going to do the exact opposite. We just worked glute with reciprocal inhibition because it was her hip flexor. that was pulling her through. Now we're going to use glute to have reciprocal inhibition to unlock the hip flexor. So we save the best and the biggest for last. This also is a big movement, so you want to use your hip to block their low back. Big breath in. As you exhale, bring your leg back as far as you can. And you want to feel their glute contract against your hip. You feel the stretch here?
Yes.
Inhale forward. Exhale back. The harder you blow, the better it works. Good. And if you want to do pin and stretch, you're going to take this hand. Inhale forward. Lock it right under the hip. Bone. ASIS. Inhale forward. Exhale back. 2 more. Breathe really hard. Blow hard. Like you're blowing a candle out across the street. Last one. And blow. Perfect. Take a break. Come here. And then nice little stroke here. Put them back together and we're going to help them up. So I'm going to have her leg.
Optional QL stretch if you want it.
Oh, right. So if this is a treatment and you're only doing one side, say you do it in a half hour instead of an hour, you wouldn't have worked this side. So you can do the optional QL stretch that nobody does. And that, she's already set up for it. You're going to come right here, hug her legs, and you lean back to lift. You don't use muscles to lift, you use leverage to lift. And it's right there sitting on my thigh. Ankle bones don't like to be smashed together, so take the top leg, put it slightly behind, and with my arm and lat, I'm going to hug her legs together. Big breath in. As you exhale, we're going to rotate, lean back, and you feel that stretch on the right side? Mm-hmm. Real gentle, right?
Yes.
So you don't want to push this because you can easily overdo it. The second they feel the stretch, that's your stopping point. Big breath in. Let me know when you feel the stretch.
Right there.
Let's see, it's very little. Really, really mobile people, you'll get it past 90. 2, well that's 3. 4, 2 more. 5, and last one. Perfect, take a break. Okay, now we're gonna help her up. And this is where you really pay attention to body mechanics. It's shockingly easy. It's because you have this counterweight of her leg. Hand above the hip, hook your elbow on top of mine. On 3, engage your core. So I have her shoulder and her hip. 1, 2, 3, we're coming up. And I'm pushing her hip down to get her up. Go ahead and take a walk, see how things feel. Whew.
Amazing.
Feel better?
Yeah.
Thanks for being a model.
Hey, thanks for
Okay.
having me.
Yeah, so this can probably resolve quicker than you think.
Thank you.
All right, see you, Trish. And so, what I didn't tell the viewing public, what's your level of discomfort now?
0.
So take a walk out to the door, come back. Just try to walk normal. And then come on back.
She got a big smile.
I know.
Yeah, she's smiling. She feels
So
light.
happy.
Yeah.
I feel tall.
Okay, so that's the thing. You ask, how do you feel different? And then they'll explain. She said she feels taller. She walked in at a level 5, which has been consistent for how long?
A year.
A year. And right now you already walked. The blood is back where it needs to be in your body. And what is the level now?
0.
0. So if this protocol worked in that short time, and you could be a 0, would your life be different?
Totally.
Totally. So this is not a normal first time ever result, but it is normal for people to be like 30 to 50% better from the first session.
Why is this not normal?
Because she went from a 5 to a 0.
Why is that not normal? I feel like that is pretty normal.
Well, okay, it's pretty normal.
Yeah.
There is always a significant change in how people feel, especially if you catch the session in the window after that initial inflammatory response. So you were in a car accident a year ago, and if you can think back to the worst pain, was that like 3 to 5 days after the accident? Or was it longer?
No, it was about 3 to 5 days after that.
So it really takes that 3 to 5 days for all the stuff that's going to happen to show up. Sometimes longer, sometimes shorter, depending on the severity. Obviously, if you're in a coma in the hospital for a month, stuff's going to show up way later. But this is a pretty normal result. But she's been dealing with this for a year.
She
So.
didn't have to.
Yes. Yeah. No, she didn't. Sorry, we didn't have to deal with it.
Now you tell me.
Yeah.
So, we're done with Joni, right?
We're done.
Okay, so I'm just gonna ask Joni one more question,
Yeah.
because Joni is also a massage therapist.
Yes,
So Joni, you took the class before, the low back pain protocol class before.
yes.
So do you recommend massage therapists take that class?
Absolutely, absolutely. And I also recommend that people practice it, because yes, I did take the class, but do I use it in my regular practice? No, because I do massage without clothes and draping and all that. But if you practice this protocol, your clients will get so much relief from their low back pain.
The results speak for themselves, yeah?
Absolutely.
Cool. And we now we have video, so you can watch the videos back
Yes,
and practice.
that'd be
You
awesome.
can take it again, we're gonna have it again soon.
I might just do that,
Okay.
because it was an amazing class, for sure. Oh my God, I feel so good right now.
Aw.
Thank
Good job,
you.
Jackie. Cool. Thank you.